The number of COVID-19 cases are on the rise in the northeastern states, and the authorities are gearing up to tackle the pandemic by setting up COVID care centers. Plasma donation camps are also being organized to treat the seriously ill COVID-19 patients. We have a report.
The state governments in northeastern India have stepped up their multi-pronged operation to stem the spread of the pandemic. While on one side, the authorities have been pushing for comprehensive preventive measures, a rampant infrastructure have been developed on the other side to bring the infected numbers down. A 150-bed COVID care center was recently inaugurated in line of Assam's efforts to expand its exclusive facilities to counter the challenge posed by the deadly coronavirus. The government's fight has received an additional wing, with citizens providing overwhelming support to its endeavors. A private organization, Marwari Yuva Manch, held a plasma donation camp in capital Guwahati, where a large number of people who have recovered from the disease participated. Earlier, in a heroic effort, the organization had saved a health worker's life by transporting plasma from Guwahati to Tripura, a 450-kilometer distance.
कोविड के अगेंस्ट हमारा स्ट्रेटजी जो है अब क्लियर हो गया है. टेस्टिंग हम लोग कंसंट्रेट कर रहे हैं. जितना भी पॉपुलेटेड क्राउडेड एरिया है, चाय बागान है, आपका बाज़ार एरिया है, कॉन्टैक्ट ट्रेसिंग है, संस्थाएं हैं, इंस्टीट्यूशंस है, जहाँ से भी कोविड का हमें रिपोर्ट आ रहा है या फिर जो हमारा कम्युनिटी सर्वेलेंस चल रहा है, जहाँ पे भी माइल्ड फीवर या रेस्पिरेटरी इलनेसेस इनका रिपोर्टिंग आ रहा है, इन्फ्लुएंजा लाइक सिम्टम्स का रिपोर्टिंग आ रहा है, वहाँ पे हम लोग एक इंटेंसिव टेस्टिंग कर रहे हैं.
Meanwhile, the state of Manipur has increased its everyday testing capacity. 13 new COVID-19 centers have also been set up. Government is also working at the rapid expansion of the exclusive COVID centers to accommodate the rising count of the patients.
Government is taking up so many measures, like the recruitment of this 150 nurses and 100 multitasking staffs at the Directorate Health. At the same time, all the districts are authorized to appoint 12 nurses and 12 multitasking staff to support their areas. And from tomorrow also, the recruitment for the 100 doctors to support the COVID management.
The state of Mizoram, which has so far been least affected by the menace of the pandemic, is taking stern administrative measures to flatten the curve. Few areas including Darpui Venthor and Mission Ventlang have gone into complete lockdown to prevent community transmission.
Itop kan chua chau zela poi ke ni hianin a thulani ti hi ka soima sadua tin Mizoram chunga COVID-19 case ni tin hian tu nai hian kan pung ve zela a kan case nei te hi zirchian na tanga alolan tan chuan para military forces kanti BSF te.
While the state of Northeast have witnessed a surge in the past few days, the governments have been successful at pushing the peak point and flattening the curve. All regions have shown a healthy positivity rate with one of the lowest mortality rates in the country. To curb the rising cases in the state, the government of Arunachal Pradesh recently inaugurated the state's first exclusively dedicated COVID-19 hospital in capital Itanagar.
आज जो यहाँ पे हम लोग टेम्परेरी जो यहाँ पे कोविड हॉस्पिटल MLA अपार्टमेंट का जो डेडिकेट किया है, तो सबसे पहले तो मैं अपना ऑनरेबल स्पीकर साहब सोनान जी को, इसके बाद डेप्यूटी स्पीकर एसएम मोहम्मद जी और जितने भी हमारा कलीग्स ऑनरेबल MLAs हैं, पूरे 60 जो असेंबली कॉन्स्टिट्यूंसी का सभी ऑनरेबल MLAs को हम धन्यवाद देना चाहेगा, क्योंकि जो ये प्रपोजल हेल्थ डिपार्टमेंट से जो हमारे पास आया, मैं तुरंत MLA लोगों से डिस्कस किया, तो उन लोग ने कहा कि आपको जो भी डिसीजन लेना है आप पूरा विद फ्री हैंड आप लीजिएगा.
The hospital is equipped with 10 ICU beds, suction apparatus and ventilators, a labor room, a neonatal ICU and many more upscale facilities.